Well, thank you. Well, if Senator Coons thought there wouldn't be anything left for Congressman Carney to say, there really is nothing left for me to say. John, thank you, and thanks for the great job that you're doing. I have to say I agree with everything that the previous speakers have said. So I just want to add a couple pieces. And before I do that, in addition to thanking all of them, I also want to thank Tina Riveros from my office, who's just doing a great job. So the most encouraging thing for me today is actually the view that all of us sitting here have of looking at all of you and recognizing how many different people and how many different perspectives are coming to bear on this issue. And to see, first of all, levels of government, the federal government extremely well represented, state government with being Senator Hull Long and others who are here. The institutions who are getting these great awards today, Christiana and Nemours. The University of Delaware, and seeing a number of different pieces of your college here. We have some amazing departments within the college represented here today. And just recognizing that there's so many different people coming together. And that is unbelievably important because it is very, very complex. We also have the DIN, the Delaware Health Information Network, represented. We just celebrated the 5th anniversary of the Delaware Health Information Network about maybe 6 weeks or so ago, and really leading the way in Delaware in terms of making sure that providers and facilities throughout the state have access to the right kinds of information about patient treatment in the past. But the main point that I want to make sure, especially that the media leads with today, is that these grants, this is not about biologically based research. This is not so much about figuring new things in medical, in medicine. It's really, and as the other speakers have said, it's about the delivery of care. And this is unbelievably important for all the reasons that they said. And I think, when Senator Carper talked about moving away from fee-for-service to a different way of delivering health care, there's a lot of talk around it. It's incredibly hard to do. And I really believe that the kinds of grants being announced today are fundamental to making these changes happen. I was talking to my good friend Tim Gardner a few minutes ago, and I know Dr. Weintraub is going to be talking about this a little bit more, but he was telling me that from Christiana Care's perspective, it's really about making sure that we're doing a better job before, during, and after a treatment, and the idea of integrating all the information which is out there for all these different patients and making sure that that information is being used correctly and more intelligently than it's ever been before just means the quality is going to be better and the cost is going to be less. And that's the irony. And I really believe this, and people may disagree, but I think the way our healthcare system has evolved over the years, this is one of those times where I really believe that if we're smart about it, we're going to be able to improve quality and reduce cost simultaneously. And that doesn't always happen, and I think there's huge upside for us here in that regard, and I think it's very exciting. So that's looking at it from the Christiana Care announcement. And then from the Nemours, I'm going to bring Dr. Churchwell up in a second. If you think about what they're doing on the asthma front, and then you read a little bit about what where this money is going to go. I don't think, unless I'm reading incorrectly, Dr. Churchwell, this is not about finding a new type of inhaler. What it's about, I'm going to just tell you very quickly about a book that I read a few years ago, and it tells a story I think so well. It's from a book called The Working Poor by a guy named David Shipman. And of course, the very name of the book ought to be an oxymoron, because people who work shouldn't be poor, but we have a lot of working poor in this country. And there's a couple paragraphs in this book about a mom, a single mom, who is raising her son, who's like 10 years old, and she's raising the son in an apartment full of mold. And this leads to asthma, which leads to an emergency run to the hospital in the middle of the night, which leads to a bill that cannot be paid for the ambulance run and for the visit to the hospital, which leads to a lousy credit report because she didn't pay her bill, which leads to an increase in the interest rate on her car loan, which means she can't afford a decent car, which means she can't get to work regularly and on time, which means she can't hold down a decent job. I mean, that's the cycle. I mean, that's the world that so many live in. I think, and as you look at at least as I understand it, the Nemours application, this is really about integrating a whole variety of those factors and treating, you know, you're not just treating the biological problem, but you're treating the conditions that lead to it. And I think in that way, you know, both of these awards today are saying there is so much great medical knowledge out there. Let's like really actually figure out how we're going to use our knowledge to improve how we deliver care, how we improve outcomes, and how we reduce costs. And I want to say to our entire congressional delegation, who are largely responsible for getting these innovation grants into the Affordable Care Act in the first place, great job. It's exactly, you know, what all of us hope that you guys do in Washington. We are very, very fortunate in Delaware to have such a strong congressional delegation. And to Kathy, I want to say, you know, how much, by the way, some of you may not know, Kathy's actually a homegrown girl. We are particularly proud because she's a graduate of Newark High School. That's not the only reason she's successful, but it's a good part of the explanation. But I do think that the leadership you've shown at bringing together people from different walks of life, different parts of the university, our healthcare providers and the like, and sort of attacking this problem together, I think is absolutely terrific. And so now it gives me great pleasure to introduce a guy who's been in Delaware for about 19 months, having come here from Tennessee, leading what is just such an important institution in Delaware, and he is taking it. It was already at a great level. He had I think the privilege of coming into a really terrific organization, and we have the great privilege of having him come to Delaware and take Nemours to the next level. Dr. Churchwell.